Hello everyone, I am Dr. Meera, fertility specialist at Oasis Fertility, Kompally. Today we will be discussing about what are the various fertility options which are available. First of all, it comes to ovulation induction with timed intercourse, wherein we give you some medications or injections for a dominant follicle or egg to form, and once it ruptures, we tell the couple to have intercourse. Second treatment is wherein after the egg ruptures, we tell the husband to give the semen sample and that sample is being injected into the female's or the wife's womb. That is known as IUI or intrauterine insemination. Now the third and the foremost treatment is IVF, wherein we give some injections to the female which are for a couple of days. After the eggs they become big, then under anesthesia or after putting the female to sleep, through the ultrasound guidance with a very thin needle, we take the eggs out and put them in the lab, wherein they are then met with the sperm and the embryo forms, which is then frozen and then transferred into the female's womb. Now coming over to what is the success chances with all these treatments. First of all, with the first or the timed intercourse, the success chances are almost around 8%. That means out of around 100 people who go for this treatment, 8 conceive. Second is about IUI, which has 10 to 15% chance of pregnancy depending on how many cycles have you tried in the past, what's your age, what is the duration for which you have been trying for a pregnancy, what are the semen parameters, and also the follicle parameters or the egg parameters of the female. So considering all these factors, the pregnancy chances are almost around 10 to 15%. That means of the 100 people who try for IUI, almost around 10 to 15 they conceive. Now coming over to the IVF treatment. So IVF treatment involves forming the embryos and freezing them. With the IVF treatment, the chances of pregnancy for 2 embryo transfer is almost around 40 to 45%, and wherein if the couple does not conceive in the first transfer, then if they have more embryos frozen, they just need to go for another embryo transfer. Now coming over to the point that which treatment is better, is it IUI or IVF? It is not that any treatment is better over the other, just that what the person needs. If a female is of a higher age, that means she is more than 36-37 years, it is preferable to move towards IVF. For a young female around 30 years who has not tried much in the past, IUI is a good treatment to have a better chance of a pregnancy. So having known that, we'll have another educational session wherein we'll discuss about the further advanced technologies which are available. Thank you very much.